Mhm.
Good afternoon, good afternoon, good afternoon. Welcome to all of you as we are about to start. We are more than 100% ready. I see lots of you coming through for life lessons. We are here to educate, we are here to have fun, we are here to make an impact, we are here to make sure that wonke umuntu lapha uzawukwazi uhamba ne-lesson, not only for uhombisa but to make sure into yoba what you learn will become a life lesson and it will make a difference komnye nomnye. Ngenani ndiyanibona, we almost there. Once we pass the 100 mark and then we'll get started. We almost there. Yeah, we're good to go, Doc. Dr. Mathabe, can you kindly greet all our followers and all our viewers before we get to the subject matter? Then I will introduce you briefly.
Thank you very much, Dr. Tebelele. Good afternoon to everybody, all the viewers that are joining us online. Thank you for taking time out to try and educate yourself and get information, because that is just so empowering. And thank you, Dr. Tebelele, for making the opportunity available for continuing these conversations.
Thank you so much. It's always lovely to have high caliber speakers and guests like you, especially if you come down to the level of our people with that kind of information. Namhlanje sihamba no Dr. Mathabe as I welcome all of you. Yamkelekani ku-Aphile Communications. Ningalibali uklika u-like and follow i-page yethu ku-Facebook and naphaya ku-YouTube. We are currently live on YouTube also. Naphayana, just click on the red bell. It must turn gray, and then you know that every time we've got life lessons nanini na sinemfundiso uzawufumana i-notification ayityi imali yakho loo nto leyo, koko ikunika ii-lessons zobomi. Dr. Mathabe is the head of urology, head of department yakwa-urology phaya eSteve Biko Academic Hospital, and then aphinde abe head of department kwa-urology still phaya e-University of Pretoria. So Aphile Communications is bringing you a very big guest, a serious academic, someone who has achieved a lot in the field of urology. Is the second female urologist to have come out of the country, especially from the University of Pretoria. And we're very proud that it's not only males that are urologists, which is actually a misnomer. And she has broken the stereotype and she has broken into the field of urology. So ngubhei wempempe oqobo. I'm very proud to have her. Imibuzo yenu ningayibhala apha kwi-wall as we go along. Dr. Mathabe, the first question that I have for you, to get things going and to make sure that our viewers are able to get lessons from the guru. There is something that we see often in our practices, in our clinics, and all over, and it's quite common. And abazali bethu, they struggle sometimes to make out what it is, and so and they panic and so on. Something that is called a buried penis or embedded penis. Can you clarify us and our viewers what is a buried penis or what is embedded penis?
Sure. Thank you, Dr. Tebelele. So, a buried penis is sometimes also called a hidden penis. And most of the conditions that we see, most of the things that we see, in clinics, in hospitals, most health conditions can be divided into two main groups. The one group is things that people are born with. They were born with that condition. And sometimes it's things that happen as you live your life, as life changes, as you experience life. So same thing with buried penis. It can be something that somebody is born with, or it can be something that happens as you proceed through life. And all that it is when we can't see the length of the penis, the shaft of the penis, on just looking and examining the patient and looking at the external genitalia. And obviously, this is something that urologists do a lot of. A lot of our work is based around work of the genitalia, both the internal and the external. And so you can't see the shaft of the penis, or you can only see a portion of the shaft of the penis, of the length of the penis. And this can be due to various reasons.
Yes.
So if it is congenital, it can just be about the skin surrounding the penis, in terms of how that implanted. So it could just be, what happened while the baby was still in the mother's uterus, while they were forming, so that as they were forming, the skin that should have been attached to the base of the penis, that you could see the whole length of the penis, is actually attached a little bit more further forward, closer to the hole where the urine comes out. And therefore, it is buried because of that reason. But other reasons that one might acquire a buried penis would be due to things like in obesity. So somebody's just really, really obese and really fat, then the
Yeah.
shaft of the penis is just covered by the fat tissue, or it can be, with circumcision. Sometimes, if there's complications of circumcisions, people who form scars in an unusual fashion. So those are some of the things that can lead to a buried penis.
Thank you so much. You mentioned obesity or people who are actually fat, that they can have this buried penis or embedded penis. And you say it also can I get it clear? It also affects old people. Can we get it on old people, or is it only something we can find in kids?
So no, you can find it throughout life. It will mostly see it in babies and toddlers, but they just tend to be chubby anyways. They are just a lot of water in their body. So in below 2 or so, we're not too worried about it. But again, this is something that must be examined by a doctor, because in order to call it embedded, buried, hidden, we imply that that penis is of normal size. So you need somebody who knows how to measure it. There's something that we call the stretch penile length. So somebody must measure it and make sure that it is actually a normal size penis for the age group of the individual that we're examining, and just that most of the shaft is actually hidden under fat tissue, under skin, under scar tissue, that sort of thing. So most of the time it's going to be seen in younger people, certainly, adults who are quite fat or obese, for lack of a better word. That's when we'll see it. Very unlikely to see it in the very high age group, sort of, beyond your, 20s, 30s, 40s, probably very unlikely. If it happens then, it certainly is acquired. There is something that has happened that has led to it, being the case.
Ugqirha uyacacisa ke, mandenzele nina ziviewers zethu, ucacisa into yoba ngokwale condition sithetha ngayo kuthiwa yi-buried penis okanye impempe engathi itshonile apha kuyo, induku le ingabonakali. Inokwenziwa loo nto ngamanqatha ebantwaneni okanye ebantwini abadala, okanye isikhumba esi sikhavarisha impempe uba siya-overlapha, then ibe ngathi itshonile impempe apha emntwaneni nasemntwini omdala. Ikakhulu ifumaneka ebantwaneni, and abantwana bazalwa benayo. Into ebalulekileyo ke ngokuthi bazali kukuyirecognize nokuyipick up kuse-early, kuzobona uba kwenziwa ntoni na ngayo. Doc, is it something that is treatable? And then the second question that I would like to ask, you talked about measurement of the penis. And when we talk about measurement of the penis, there are gurus or people who pretend to be gurus in measuring the penis, and then they go around insulting other people about the size of the penis and so on. How do we properly measure the penis as a urologist? What is the proper way of measuring the penis, if we do have energy to measure one, so that we can categorize it?
Sure. So in terms of the treatment, I'll answer the question on the treatment first. It is treatable. It would be treated by surgery if it is determined that it does need surgery, right? Because it might not need surgery. So if it's in somebody who is fat, that is just such an ugly word, right? I know in medicine we tend to use the word obese, but at the end of the day, if you are larger than what you should be, and there is just extra fat tissue around your body, doing an operation is not going to cure the problem, right? Then and in fact, maybe what I should have opened up with right at the beginning is that issues of this nature demand a multidisciplinary approach. You know what I mean? This is one space. Issues of genitals definitely should not be treated by just one specialist, or should not be assessed through the lens of one particular discipline.
Yeah.
And here, psychologists play a big role. But we're going to need, if somebody is obese, my taking a scalpel and taking him to theatre is not going to fix the problem. We need to get on an exercise program. We need to bring dietitians. We need to bring those other specialities. So not everything is going to be fixed by a pill, and certainly not everything is going to be fixed by surgery.
Yeah.
However, once an expert in the field has examined the child or the person presenting with a concern of a buried penis and has determined that this is indeed the case, a buried penis, and that it is not something that can be fixed by, diet and exercise and any of that, that the child or the person actually needs surgery, then certainly surgery can be done. Surgery, depending on, how severe the condition is, surgery can be done by the urologist alone, but sometimes we might need to have the input of the plastic surgeon, because their discipline is very much about cosmetics, how things look, the aesthetics beyond just the function. And if there are flaps and grafts, specific surgical techniques needed, it might be that
Yeah.
we might benefit from the input of a plastic surgeon. So for sure, this is a multidisciplinary, and I think I say that all the time whenever I'm with you. Many of the things really just need more than one pair of eyes looking at them.
Wonderful.
And then, if I may move on to the measurements, can I do that?
Yes, please.
Okay. So with regards to measurements, again, I feel very strongly about research and research on the African continent, because, the numbers that you and I have spoken about in terms of the measurements of the penis. So it is important for me as a urologist and the other disciplines, the other colleagues in various disciplines, when we see a newborn baby. So of course, this will be done by the midwives and the nurses. The obstetrician and the gynecologist are more involved at this stage than we would be. But when a child is born, sometimes, and we've spoken about this also, DSD, disorders of sexual differentiation. So when we
Yeah.
look at the external genitalia of a newborn baby, we must be able to determine if it's a boy or a girl. And part of
Yeah.
that determination is in the size of the phallus. So that which we are seeing on the, as the external genitalia, the phallus, is it actually a penis or is it a clitoris?
Yeah.
And depending on which one we determine it is, size really does count here, because we call it the stretched penile length. So where
Okay.
we measure from right up, if you just, if anybody just feels against your own genitals, the front, where you can feel that bone, that pubic bone. So we measure from the pubic bone to the tip of the phallus, where the urine comes out, the hole where the urine comes out. That's the measurement that we take. So, and this I always say to men: if you are standing and you look at
Yeah.
your penis, if you look down, there's the abdomen that's in the way. There's the
Yeah.
pubis that is in the way. So you can't look down and determine the size. So already just that assessment is going to give you something to be scared about. So we really do need slightly more objective things. So absolutely, stretch penile length from the bone, from right up against the bone, right up against the pubis, and we measure it to the tip where the urine comes out, stretch penile length. So on average for a newborn baby, it's about 3 centimeters. So we need to
3
know
centimeters.
about, yeah. So 3 centimeters, but if it's sitting at like 2.5, 2
Yeah.
centimeters, then we start to worry, is it perhaps an enlarged clitoris? There are conditions where their baby, while they're still inside their mother's tummy, is a female baby, but stuff that is happening is making that clitoris grow longer than what it should be. So we need to determine, is this an enlarged clitoris or is this a short penis? Right? Very, very critical. But also the numbers that you and I have spoken about that we have checked, these are international figures. And who on earth is international? What does international even mean? The world is so broad. And therefore, if you're going to look at numbers of, people who, live in Europe, people who live in America, who have different diets and that sort of thing. So for
Yeah.
me, the role of the South African trained doctor in contextualizing for us what is normal within the South African context and what is normal within the African context. And, even if we say, okay, by African standards, this should have been 10. So again, that's where the research needs to come in. But even if we do, our continent-wide studies, we come up with our own numbers and we say, and we should, there's also a difference in terms of the penile length, in terms of whether it's flaccid versus if it's erect. So also
Yeah.
people might be measuring it at the wrong time. And so really we need the healthcare professionals to contextualize people's questions and measurements and wondering. But let's say we do continent-wide studies and we come up with a figure. Let's call it, 12 centimeters, 11 centimeters, 9,
Yes.
whatever it is that we say is the number. At the end of the day, if we've decided that the number is X and you measure yourself or you have a healthcare professional measuring you under the right circumstances, and we've got that, and now, instead of X, you have X minus half a centimeter or X minus a centimeter, then what? Is your whole life going to be destroyed because your penis is a centimeter shorter than
The
what is
centimeter less, yeah.
You know what I mean? So it cannot just be about the number. There's got to be more to this whole space than just a figure, right? And if your penis is then X plus one, right? But you are still a terrible, angry person who treats everybody unkindly and whatever. So
Yeah.
what? You're X plus one, but you're a horrible person. It
Mm,
can't just be the number. You know what I mean? So we really need to
perfect.
just look beyond the number. So that for me is what I say. That's what I preach, that the number means very little at the end of the day. You are a whole human being. You are not just your penis. There are other aspects to your life that need to come into this. But yes, so I mean, we do have the figures. So the international, whatever that means, figures that are put out is that the average penile length in a flaccid penis is about 9 centimeters, 9.1, 9.2. And the erect penis can be, 12, 13 centimeters. But, so what?
Thank you so much for that clarity. So, in essence, you are saying the diagnosis of micropenis or embedded penis is more like a clinical decision. You observe and then you make out your mind based on what you see. But is this a real penis or is it a clitoris? Let me just clarify a little bit to catch up in ugqirha uthi kule condition esithetha ngayo kuthiwa yi-embedded penis apho ufumanisa into yoba impempe le yomntwana okanye umntu omdala ingathi ngcwabekile apha kwisikhumba esi befama sayikhavarisha okanye kulaa mafutha alapha kweli thambo lilapha esinyini, ufumanisa impempe ingathi itshonile phana. Then kufuneka bona bohlulahlule into yoba ingaba yiclitoris na, ingaba yimbotyi na okanye yimpempe engakhulanga kakuhle. Then kunendlela ke ngokwe-professional, indlela abaqeqeshwe ngayo yokumejarisha impempe endingaqondi into yoba thina abantu badla ngojonga impempe nje apha esithubeni asinazi-tape measures. But indlela eproper uthi ubeka i-tape measure phaya kwibase apho iqala khona impempe, then iyotshayisa entloko. Then uthi umntana silindele into yoba abe phaya ko-2.5, 3 centimeters. But uba ungaphantsi ko-2.5 centimeters, then iingcaphephe ziqwalasela into yoba akungebi lo mntana uphantsi kwale nto sithetha ngawo namhlanje sithi ingcwabekile impempe yakhe okanye i-embedded, le nto sithi yi-buried penis okanye i-embedded penis. Then doc, how would a parent actually see, what symptoms would a parent see in terms of urination or and so on, so that they can rush the kid to the clinic in case it was missed in hospital? What can you tell them to notice so that they can bring the child back?
Yeah. So the thing with an embedded penis, so I know we touched a little bit on the micro penis and we'll talk on other things, but a micro penis, for all intents and purposes, is completely normal other than the size. So it looks normal, it functions normally. And I mean, in the young child, obviously the main function we're worried about is urination. At that point, we're not talking about sexual function. That'll be in the adults. But so a micropenis will function well enough in a child because they can pee. And so even from that perspective, we won't necessarily pick up anything is wrong. However, an embedded penis, there might be difficulty with peeing, and not so much that it's difficult to pee, but that it might be messy. So because the shaft of the penis is not outside of the body the way it should be, there might be difficulty with pointing, because obviously with men you got to stand up and point to pee. So
Yeah.
if the person cannot hold the phallus, there isn't enough of a phallus length to be able to point and pee, that would be a problem. So you might find that the person is, a few drops of urine are going onto their skin. Now we're starting to have skin rashes, we're starting to have uremic rashes. I might even get fungal infections because that area that's supposed to be nice and dry is now mostly wet. So those would be the things, the difficulty with peeing. And certainly in an adult, an embedded penis is going to cause problems with sexual function then. And that might be the reason that somebody actually first raises the issue that, I think I have a problem because it is interfering with sexual function.
I like the fact that you emphasize. I'm sure, in fact, one of the comments from Larry Bryce Hrobler, loving Dr. Kgomotso, classic information. The number is just a number, get dog. And then there's another comment. So measurement must be based on a certain context. Or I like that you placing the human element more than the digits that are attached to the small organ, that people can even go to commit suicide over the size of the penis. Bukeli bethu ukugxininisa nje into eyi-one kwezinto zithethwe ngugqirha. Umntana osanda uzalwa sinoqaphela into yoba impempe le ingcwabekile apha kulaa mafutha alapha esinyini, okanye isikhumba esifama sikhavarisha impempe siya-overlapha siphele siyigquma. And then kwezo zinto wahlulahlula into ezimbini, sinento esithi embedded penis okanye i-buried penis, siphinde sibe nento esithi yi-micropenis. Ugqirha uyacacisa into yoba i-micropenis is normal but incinci njengesize. Incinci, umchamo uyaphuma kakuhle kuyo, but incinci mhlawumbi 2.5 centimeters or less emntwaneni. But umchamo uyaphuma kakuhle. But kwi-embedded penis ubalisa ingxaki okanye ii-symptoms nonoziqaphela into yoba xa umntana echama kuhamba ngathi kuyadumba, ibe ngathi isikhumba esi si-around amatyhalarha siyavuthelana, okanye isikhumba esi si-around intloko yempempe sibe ngathi siyadumba ngenxa yoba umchamo ukwazi uphuma kakuhle. Then kunobakho uhlaselo lweentsholongwane, into esithi zii-infections, then umntana aphele iba ne-discharge encinci and athanda urhawuzelelwa, abe ne-rush around ilantuka i-private organ le, ngenxa yale ngxaki into yoba umchamo awuphumi kakuhle ngoba i-buried penis le. And xa sele idiscoverishwa emntwini ongutata osemdala, uzawuba nzima ubamba intonga le yempempe, that is isiqu esisempempo, le nto sithi yi-penile shaft, ngoba incinci. Then kunosokolisa indlela zochama, naxa sifuneka kwabelwene ngesondo, yimpempe engabambeki incam leyo ezawusokolisa ke kumcimbi we-sexual fulfillment. Nazo izinto eziphambili ngezi meko zimbini, embedded penis ne-micropenis, zohluke ngolo hlobo. Doc, let me quickly take you through what is a small penis syndrome.
Okay, so this then very much brings the psychological aspect to this discussion, because that is then more of a psychological issue than a physical issue. Because if we examine such a patient, so a person who presents to a healthcare professional with this concern, and the thing is, most people won't present to a healthcare professional with this, but let's say they do. A person who presents with this, first of all, upon examination, the penis is...
Let's sit on the presentation. On the presentation, this guy would come and complain that, hey, I think I've got a small penis, or my girlfriend or my wife is complaining that my penis is small, and so on. That would be the nature of the complaint.
Absolutely. And I'm just going to digress for a minute. In the studies that were done in trying to determine, the average standard penile length, they in most cases, in over 90% of cases, patients will have a certain penile length in the flaccid state, and then during erection it is longer. So if you're to measure it erect, then the size, there's extra centimeters. But there are some patients in whom, when they are erect, it measures slightly smaller, right?
Yeah,
So we need to be aware of that as well, that it
that's
could be
minimal.
that when it's erect, it's a little bit shorter. Okay, now moving on to, what people who have concerns about having a small penile
Small penis
size.
syndrome. Yeah.
Small penis syndrome. So absolutely, the more medical term is penile dysmorphic disorder, but that is part of body dysmorphic disorder, and
PDD.
that diagnosis is absolutely within in the health sciences. It is within psychology and psychiatry, because these are then not physical abnormalities, which does not mean that they are not real, right? So the person who is experiencing this, for them, it's a serious and distressing situation. And before we call anything, a small penis syndrome or penile dysmorphic disorder or whatever it is, we must examine the patient, right? We must examine the patient and just make sure that there isn't something physically going on. And so at examination, we're going to look. This is not a buried penis, right? This is a penis. You can
Yeah.
see the full shaft. You can see the glans. Everything is fine. Upon measurement, it measures, within the normal range for the age of the person. So
Hmm.
from that perspective, also, there's nothing. This person is able to pee. There are no concerns with that function. This person might or might not have difficulty with sexual intercourse, but then we need to determine, is the cause of the sexual intercourse a physical thing, that they can't get erections, they get weak erections, that they have early ejaculations. So there's all the other things that we must look at in terms of sexual function, but that is probably not even an issue as well. And having excluded all of those things, and having shown the patient, so whenever I see patients, I try very hard to show them what I'm looking at. I think doctors must do that so that patients are on the same page with us. So if I
Yeah.
measure the penile length and I'm like, look, it measures 11 centimeters, this is within the normal range. So with all of those things, that you make sure that your patient is with you as far as possible. But if after this entire conversation and we've checked everything, and we might do blood tests, especially testosterone levels are important. So once you've done everything and you say to the patient, look, everything is fine, and they are still
Hmm.
insisting that no, everything is not fine, you know what I
Yeah.
mean? That's when you might need to say, okay, do we actually need to bring in a psychologist to this? So is it actually a psychological experience that makes it seem like there is a problem, when we have excluded the things that we would worry about from a physical perspective? And I mean, it's the same thing with, people. There are people who have issues with, the size of their ears, or the size of their nose,
Yeah.
or the size of their butt.
Yeah.
It falls very much within that category. But I mean, some people just say, look, your butt looks fine, like you're all right, your ears look fine, and they're fine. You sort of talk them through it and whatever, and they're fine. But some people, it continues to be a real problem, and that they will go and insist upon having surgery. And that's why this is a very important part of the teaching for plastic surgeons. Plastic surgeons need to be very aware of body dysmorphic disorder, because you don't want to just be operating on various body parts that are actually normal in function and appearance and all of that. And you are operating now because you might never be able to fix it, because the problem is not actually that my ear is too big, so certainly for plastic surgeons, this is very important. So absolutely, with small penile syndrome, we if somebody really does feel that this is an issue, they must not be shamed into not exploring and not asking questions and really engaging with somebody who understands and cares. But once we have done that, if we have checked, because sometimes we check and we find that there is a problem, right?
Mm.
So if there's a problem, then we sort that out. But sometimes we do everything and we check everything and there isn't a problem, at which point we then need to, with that multidisciplinary approach, say, you know what, this is not actually something for a urologist to sort out. This is not something for a plastic surgeon to sort out. You might need to have a conversation with a psychologist. And let's do that without being judgmental.
You touched on a very important aspect. I see Dr. Unat Makiwan is watching us from Canada. And Butlinda Ngcishe is watching us from Tata. You touch on a very important aspect involving plastic surgeons. Women are at liberty and will to go and see plastic surgeons, and they ask for vaginal rejuvenation or vaginoplasty and so on. Are men who feel that their penis is small, like those with this PDD, that is small penis syndrome, at liberty to go and see a plastic surgeon and ask for penis enlargement. And coupled with that, there are a lot of men who are moving up and down because of pressure from women that they've got a small penis, and then they start getting sold creams, pills, concoctions, and all sorts of things. And some are planting trees and whatever with the hope that they will have a penis growing. Unfortunately, we're on the other side of Pretoria. Have you seen men having penises that are growing, or is it something you see pamphlets all over the streets and so on? Can you comment on that as a guru?
Sure. So, I mean, yeah, Dr. Tebelele, my perspective really is that, you know, surgery is not the answer to everything. And we, I mean, I'm just going to say that over and over again. So in circumstances, I mean, I know we speak a lot in this country. We speak a lot about gender-based violence and all the things that go on between couples where it is the female who is being oppressed, who is being beaten up, who is being prejudiced in whatever way. But these things certainly can work the other way, right? There certainly are men out there who are experiencing terrible times due to whatever reason, and that is equally unacceptable, right? People are so different. I mean, if you just lined up 10 different people
Yeah,
and you looked
exactly.
at their nose, just looked at their nose, none of their
Not even
noses
the
look the
penis.
same, right? That no, there's a basic structure of what a nose looks like, but no 10 noses are the same. So why are
Exactly.
we insisting, that this penis must look in this way and this vagina must look this way?
It's
It's
women who are pressurizing men.
yeah. So I mean,
They
not
say
to
buy
be
a high car and so on, and they insult them. That is why they are gripped with anxiety, and then they go from doctor to doctor and thinking that they've got a small penis. In fact, there's a study I was looking at, a 2014 study that shows that all the men who were participating in that study were concerned about the sizes of their penis. They were all found to have normal penis sizes. Exactly what you are saying. You said a very nice opening statement that PDD is a psychological disorder and not a physical problem. So those penises were all found to be normal. There's a comment from Kolisi Kuzwayo. He says, thanks for the information. As a grandfather, I encourage young parents to take notes. Great work from Durban, KZN. So that is they are taking notes of everything. And there's Unati likes the illustration of the nose because the nose is exactly similar to any other. We can take the ear, we can take the nose, and so on. Why are people busy with the penis and so on, as if a penis is supposed to be everything? And the pressure that is created over men is like you go and choose your own penis and come back with a bigger one. They get
right.
insulted, they go on to commit suicide, they move from doctor to doctor, they move from Sangoma to Sangoma and are very busy trying to get concussions to get a bigger penis. Let me just touch on on something that we do at Apile Communications. We are pushing a doctrine or a concept that says a 5 centimeter penis that is erect can do enough to satisfy a woman as long as you both know what you are doing. What is your take on that?
Yeah. So again, I'm wary of numbers, 5, 6, 7. I'm wary of numbers, but absolutely, it's about the quality of the engagement. It's about the quality of the relationship, right? Okay, so this guy's got a 5 centimeter penis when it's erect, right? And you're going to say, okay, I'm not interested because I prefer that it be 6 centimeters. So
Yeah.
in the same breath that we say to women, if you are in a space that is not nurturing, that is not supportive, walk away. Right? Same thing to the men. Why would you stay in a situation that is so horrible, that makes you, where you are belittled and your self-esteem is being questioned?
Mm.
So yeah, really, nobody has a right to make any other person feel like that. And if you're in a situation where you're being made to feel like that, like walk away. Certainly see a doctor. See a doctor. have them check that there's nothing serious going on, because sometimes there are serious things going on, right? Let us check that the testosterone levels are fine, in terms
Yeah.
of issues of fertility, sperm production, and if that is fine, then move on. Don't allow yourself to be in a situation like this. So really, and the thing is, some of these concoctions that are out in the market are untested. They are not necessarily made in places where there's good quality control.
Mm.
So there might be things in there that shouldn't be in there. So it makes it very
Mm.
difficult. It's an unregulated space. It's again playing on people's psychological needs. And therefore, we're just going to do things that, will make me a quick buck. Of course, there's stuff that's proper and that's regulated and whatever. But some people are taking advantage of people who are so psychologically vulnerable.
Yes.
And that can lead to other problems, right? If you take medication and we don't know what's in it, and you're having side effects. I mean, we've had patients who, one, with normal medication that is regulated and all of that, FDA approved. And yes, I know all about, stuff that, Afrocentric medicines and all of that. So that's a whole nother conversation. But
Yeah.
for now, sticking to the Western medication, FDA approval, all the pharmaceutical and quality checks in place. If you take too much of that, you can end up with a condition called a priapism. So
Yeah.
now you started off with a normal size penis, but there were issues in your relationship that made you question your self worth. You go
Hmm.
and you take this extra medication. Now you've got a priapism, which is an erection that lasts beyond 4 hours without any sexual stimulation or beyond sexual stimulation. And the only way that we know how to fix it, so eventually you're going to present to a doctor because eventually this starts to hurt.
Yeah,
In the
because it's
first
very
few hours,
painful. Yo, that is very painful. I've seen men with it. They move around the house. They are sleepless. It even creates headache. It's no longer an
right?
enjoyable erection. It's a
Exactly.
thought-provoking erection.
In the first hour or two, you're thinking this is cool. By the fourth, fifth, sixth hour, not so much. So eventually you're going to seek medical help. And the only way that we know how to fix this almost definitely guarantees that you will have erectile dysfunction for the rest of your life.
Yeah, that
Right?
could be
So
the
do
last
you
erection,
really
actually.
want to risk that? Do you
Mm.
really want to risk that? And then, of course, with some of the other stuff where it can end up with, kidney failure and all sorts of very, very disastrous effects, right? So do you want to have an honest conversation with your partner, about what is going on? Or do you want to put yourself through all of this and potentially end up with permanent erectile dysfunction, kidney failure, all sorts of other stories? We really need to, bring the conversation back, and bring it back to the conversation actually between people.
In fact, the fact that we're touching on kidney failure, there's someone who also commented on the issue of kidney failure that some of these things end up causing a kidney failure because they are untested, they are not researched, and so on. In summary, ugqirha uthi impempe xa ingemanga yomntu ongubhuti inako umezarisha on average umyinge ophaya ku-9 centimeter, 9 centimeter xa ilele, but asifuni ukuzixakekisa ngomcimbi wee-numbers. We don't want to bother about the numbers, but about abantu. Le nto ingumntu, iquality le yomntu. And then xa imile impempe inako ukuyotshayisa phaya ko-13 centimeters umyinge, but nalapho uemphasiza into yoba masingabi bhizi zii-numbers. Usenoba nenamba ube nempempe enkulu, ube nempempe encinci, but ujonga iquality le yomntu nento yoba ningabantu abanjani, niyadibana na, and so on. Into yonxunguphalisana nokuncwalana ngokwe-sizes zempempe yile nto ibangela abantu banyuke besihla okwamanzi olwandle, baphele besitya imixube eza kubakhubaza izintso, besitya imixube eza kubenza sose kuphuncuke naloo thishu, icekeceke le nto yenza impempe iphakame. Ezaa nyama zisenokwenzeka ukuba ziphakame ixesha elide, uba nale nto kuthiwa yi-priapism, that is uphakama kwempempe into engapha kweeyure ezine. Ayonto imnandi ke leyo, sendiyibona amatyeli ngamatyeli, yinto eyenza indoda ingqunge igqiba indlu yonke. Ithi nalaa nto ibiqale kamnandi ukuhlekwa, kucinga uba le mpempe ime kakuhle izawungena, then iphele ke ngoku ingawi. Uba ngachama ayiwi impempe, ime umphelo. Laa nto kuthiwa yi-priapism leyo, and kufuneka inyango ingaphelanga iiyure ezine. Kusenokwenzeka into yoba iphakame okokugqibela, ngoba xa iyothotywa etheatre zii-urologists, laa tissue iyonakala, then impempe ingaphinde iphakame, kuphela ukutya ekhapha. Yiyo le nto sikhuthaza abantu into yoba yonke into eginyayo yazi into yoba izawungena njani emzimbeni, isebenze njani, iphume njani. Ingestion, digestion and excretion. Ungaseli into ongayaziyo. Plus nalo mntu ukuthengisela le nto, the person who's selling you the product, naye mhlawumbi unale ngxaki unayo. Yile nto ndithi kuni, sometimes you should ask the person to show you theirs. Makakubonise le yakhe. Masikahambe sigaxeleka, and uthi abalukhuthazi utyando lwempempe for izizathu ezininzi, ngakumbi ezininzi zivele zifumaneke into yoba ziphilile. Then kukho intlonti ethanda ukwenziwa ezikolweni yobhulisha abantwana ngokwesayizi yempempe, abantwana bajongana amaqhuma kwii-underwears, hayi eyakho incinci, eyakho inkulu and so on. Masibatitshe abantwana bethu as leaders and as parents uba bangafokasi kumcimbi wesize, bangajongi ii-numbers. So hlukanani nee-tape measures so that abantwana bozothatha ityhuni kwalapha kuni, bangazoxakeka yile syndrome sibhizi nayo namhlanje. Uthi ugqirha yi-PDD, penile dysmorphic disorder, okanye ngamagama avakalayo small penis syndrome, ngoba abantu abaninzi abaxakene nocimba baneempempe ezincinci kwizitadies ezininzi ziye zifumanisa into yoba zifolisha within normal, but equality ebalulekileyo nokuandastandana phakathi kwenu nobabili, nokwanelisana ngeendlela ezininzi. Dr. Mathabe, I'm just looking at questions now. If there are any person who've got questions for you, otherwise, is there anything that you want to add?
Maybe just to reiterate on what you were saying, that I've heard the statement in various places that everything rises and depends on leadership. And we've made leadership something, about politicians, about people in high positions and things. But leadership starts in our homes. Leadership starts in how we raise our children. Leadership starts in how we behave towards our partners. And that's where a lot of these things need to return. And I know a lot of talk about the African way of life and how we used to do things. And I really think we need to return to some of those things. The things that serve us well as communities, that make us whole as communities. And I mean, we could apply this to anything. We could apply this to women and breast sizes. Women want to have bigger boobs, and then you have such big boobs that they're hurting your back. That it's actually a physical problem now. We got to be worrying about your back. Our kids and their matric results. So I mean, the question of leadership applies in every space. This happens to be just one aspect of it, and a very important aspect. And of course, I mean, I'm all about women empowerment, and I'm very fortunate to have had the opportunities that I've had to be in this place. But I think men's empowerment, men need to be having conversations. Men need to be having conversations outside of what is happening with women. That's the only way we're going to create strong societies. Is men need to be talking to each other and teaching each other and informing each other. So yeah,
that's what we're actually doing. Thank you for that encouragement. We're doing a lot fortunately, as Appeal Communications, we attend a lot of men. We get invited in men's seminars. We get invited even in women's. Even yesterday, I was attending a men's seminar where we're talking about the fact that men don't cry, men face a lot of depression, and men get insulted a lot about their private parts, and they lose a lot of self-esteem and self-confidence. So the issue of size is a very serious thing, and some people, it goes to their heads. Community mobilization programs must include youth doctors for prevention purposes. That is what Bongani Dawson is. That is leadership. And the doctor from Canada agrees with you fully that leadership is supposed to be integrated in various topics, including this one. And there's someone who's talking about use of sachets to last longer. I think that those are the concoctions that we said. Some of them may lead to priapism. Watch what you're using, and make sure that you understand what is our pelelapi, is our puma, is our genapi, iyo pumapi. I think those are the few questions I have. And then, is there anything that you eventually do for someone with a micropenis? Do you, in terms of your experience? I know you've been to England, you've been all over the world. do you get any good results in terms of after working on it? Is there anything achievable after management?
Sure. So the thing with micropenis, and thank you for bringing us back to this, because I think we jumped some of the other things that we'd spoken about earlier in terms of treatment, diagnosis, what can be done. So depending on the age of the person who's presenting with micropenis, and depending on the assessment of what is going on. Like I mentioned, that testosterone is quite important. So,
Yeah.
and if you're going to go to a healthcare professional who's going to assess, they're not just going to assess the size of the penis, right? We got to assess the size of the testicles. We got to see that there are two testicles in place. They are correctly positioned. They are the correct size, because the testicles produce testosterone, which is responsible for the sexual function, for the fertility, for the penile growth. So those must be assessed as well. And so sometimes it might be that all that we need to do is to supplement the testosterone,
Testosterone,
which
yeah.
also must be done in a very deliberate and cautious way, because depending on, there's a different way of improving the testosterone levels, depending on whether somebody is trying to achieve conception. So if they've got an issue with the penis, for whatever reason, the size, the sexual function, all of that. So if there's an issue with the penis, but there's also an issue with fertility, we have a very different approach to if the problem is just the penis. So testosterone levels, sometimes you find that you need to improve on the testosterone levels. And if there is also the concern about fertility, then we have a different approach. So certainly sometimes just testosterone. There's testosterone creams, there's testosterone injections. So that might be all that is needed to help things along. But unfortunately, in some people, that will not be enough, especially in somebody who is past puberty. So a micropenis past puberty does not respond very well in terms of increase in size to testosterone supplementation. And this might be a situation, again, where the psychology is important and the psychologist's perspective, because a micropenis, we say, is actually, so the standard length, the whatever that it should be, say it's 9 centimeters in the flaccid state.
Yeah.
If it is 2 standard deviations less than that, and I was never a big fan of statistics, so but that bell-shaped curve and the standard deviation. So we say if it's less than 2 standard deviations, smaller than what it should be, which would put it at about 7.5 centimeters, right?
Yeah.
So if it is 7.5 centimeters in the flaccid state, and you are already an adult and you're not going to respond to testosterone supplementation to get a further increase in the size of the penis, there really is very little that we can do at that point, right? But is a 7.5 centimeter penis really like that big a deal, right? Can we work around it? So can we have, cognitive therapy with a psychologist to work around that issue, because we can't do anything else. In patients where, say, the penis is, 4 or 5 centimeters, where it really is a very big problem, very far removed from what the normal size should be, then the surgical interventions, quite devastating, right? So doctors are always having to weigh the intervention. So you come to me and you've got a problem, and you say, you know what, I've had this bad cough for 5 days. Now, in terms of what I'm going to do about that cough, I've got to make sure that what I'm doing is more likely to cure the cough than it is to, make you more sick or kill you or whatever. So we're always having to weigh the benefit versus the risk, right? So sometimes somebody comes to us, so let's say in a patient who had a circumcision complication and has lost part of the penis or the entire penis. That's quite a different situation. The surgical interventions that we would then consider in such a situation are very different to somebody who's got a 7.5 centimeter penis. So we always got to be weighing. And again, that's that thing that I was saying about contextualizing the problem, having a South African doctor who is aware of the circumstances on the ground, who understands the culture, who understands the Western science, and can then, distill all of this and have a conversation with the patient to say, based on this, this is what's available and this is what we can do. Because we don't want that our attempt to help makes things worse.
Yeah.
Right? We really got to try and balance that our help does not make things worse. And sometimes it can. Sometimes it can. So the circumstances must really demand the size of the intervention. Like that statement about, bringing a knife to a gunfight, right? So it depends what kind of fight this is, that we must bring the appropriate measures to help to fix it.
And then there's just one paragraph that I'm gonna read from Sobele. While I'm just about to read this comment, we left with about 7 minutes. But in that few minutes that are left, there is a bit of anxiety and pressure that is created among South African men, that the men from Central Africa, like they are a bit endowed compared to South African men, and that is creating a lot of pressure. I would like to have your comment on that. Maybe that is one of the issues that is leading to PDD. And then this comment says, and dog, let's face another things that are happening each and every year or daily. The pressure men are getting on this matter, e.g., my wife or my fiance just dumped me. Reason of my small penis on that note doesn't end, because I let her dump me and then I continue with my life. But on that note, I will hear all over from her friends that I have a small penis, and that is why she left me, as she said. That makes anger so that I can kill her. Then she's not gonna talk about me anymore. Any advice on that?
Okay. Thank you for that comment. That is quite a serious comment. I will maybe start with the men from other parts of the continent. So men from other parts of the continent tend to be taller than South African men.
Mhm.
So are you getting yourself into a state because this person is 20, 30 centimeters taller than you, right? And if so, then what? You know what I mean? He is taller than you.
I
He's maybe
like
got a
her.
bigger penis than you. What are you doing about it? Like, I fail to understand. And this is maybe sometimes where in conversations with male colleagues, where they say, it's because you're not a man, right? But I'm just like,
Yeah,
his penis is 5 centimeters longer than yours. Now what? Like, life stops?
it's
You know,
gonna leave me behind. It's gonna take my fiance and so on.
and if she can be taken on the basis of that, you're probably better off without her. You know what I mean? So like, you can't change it. Sometimes this thing about that which is inevitable, we must just accept. There are some things we just must accept. So
Yeah.
if it is that you have to accept that this man standing next to you in the urinals, and I don't understand urinals, right? Like, that for me is also like, why do men have to stand next to each other to pee? That's like already going to cause problems, right? This is a private affair. That's why girls go into the stall and we pee on our own. We were starting problems with this. But so seriously, if this guy is
And then if you run away from urinating together with other men, it's like there's something you're hiding.
right. So really, I mean, we've really got to prioritize what are the things that are important to us. Are we interested in building the country? Are we interested in learning how to fix ESCOM? Are we interested in having rich relationships? Or are we sitting there literally measuring penises and getting into a state over this? Right. So I fail to grasp some of these things.
Oh, I enjoy you.
Then moving onto the comment that was
Excellent.
made. I'm so sorry to the
Yeah.
person who made that comment that they have had to experience this. It is not okay for anybody to speak about another person in this way. And unfortunately, so I'm just going to say she's really not much of a lady. If she's got these issues with you, and not only are these issues between the two of you, and she's now speaking about them in the general community, and that people now are starting to like, that is terrible. That is just like, she really. So I'm sorry that you've had to experience that, and unfortunately, there's not an awful lot that you can do within the community. These are people that know you, and these are people who have been told this. There's not much that can be done, but there are amazing people out there So is it that, you've got to be in a different city? Do you have to move to just be amongst people who don't have this filter about you, that don't see you through this filter? Is it just you've just got to ignore it, find yourself a partner who is decent, that you can build a life with? So I'm not sure what the best advice is, but just to say that it's very wrong that you have ended up in this situation. You know what I mean? So maybe do still go see a doctor, make sure that there isn't something seriously wrong, and if there's nothing seriously wrong that should be fixed, then move on with your life. Sounds like you're better off without somebody who would actually treat you in this way.
Thank you so much, Dr. Mathabe. I like your answers. The way you answer these questions is very encouraging, and is beyond reproach, and it goes beyond one person. And I see a lot of comment. People have absorbed the lessons because these are life matters. These are real life issues. This is not theory. This is something that is affecting a lot of people. Some of the issues of gender-based violence are emanating from these things. Mandenze isishwankathelo. Sithethe ngento yokungcwabeka kwempempe xa sibiza sithi embedded penis okanye i-buried penis. Watsho ugqirha into yoba ibonakala njani impempe le, isikhondo sayo siye siqabavu apha emzimbeni. Xa unenteshe ke inokwenzeka loo nto leyo ibe ngathi impempe le ibusithela, okanye xa ingumntana enamafutha abuntwana, le nto sithi childhood fat, inako ukwenza impempe le ibingathi itshonile apha emzimbeni. Bathanda abazali upenika kabe lo mntana engakakhuphi ne-testosterone, bafune into yoba impempe lo mntana engathi incinci. But xa i-embedded penis okanye i-buried penis iyabonwa ngogqirha bayixilonge, sisigulo eso, then ifumane utyando nolungiso ingekabi nazo izinto ezizayicomplicata like ii-infections and so on, nento yoba umchamo xa ichama umntana ufumanisa into yoba kuyabhaluna okanye kuyadumba phaya kulaa area. Then saphinda sathetha ngento esithi yi-micro penis, yimpempe leyo encinci eba phaya ko-2.5 centimeters nangaphantsi, yona inormal kodwa incinci ngesize. Wathi ugqirha funeka ke ngomntana atshekishwe amagazi for le nto kuthiwa yi-testosterone, then ezo zinto urecognizwa kwazo ziyakwazi ukorekishwa. Then saphinda sathetha ngomba ekuthiwa si-small penis syndrome. Ugqirha xa ibiza, ugqirha omkhulu uthi yi-PDD, penile dysmorphic disorder. Ungatsho nasesirhoxweni uthi PDD, bekuthethwa nge-PDD namhlanje. Yinto leyo ethanda ukuqoba amadoda apha entloko engqondweni, umntu atshutshiswe kukucinga into yoba impempe le yakhe incinci, okuzithelekisa nabanye, oyike nochama nabanye abantu, adeske amane siya koogqirha nakuzo zonke iindawo ekhangela nemixube yokwandisa impempe kuba enento yoba incinci. Ikakhulu abo bantu impempe zabo zinormal, qha batshutshiswa yinto elapha entloko. Uthi kugqirha into ayigxininisayo, masingabopheleli ubomi bethu kwiinto zee-measurements. She doesn't like the issue of centimeters at all. People shouldn't be troubled about centimeters. Ude athi kolu xinzelelo sizifakela lona lwamadoda asuka phaya kumbindi Afrika nakwezinye iindawo, sithi siyazidubana ngoba emade kunathi. Kutheni singazidubi ngento yoba bade abantu kunathi? Kutheni sibafutshane thina South Africans? Kutheni sizawujonga impempe only? Ndiphinde ndithanda umzekelo awenzileyo, wathi kutheni singake sijonge iimpumlo zethu, sithelekise iimpumlo zethu, sikhathazwe into yoba my nose is shorter than hers, eyakhe isharper than eyomnye. Kutheni singazidubi ngezo zinto? Neyiphi ni-organ sike siyikhompethe. Laa nto sithi yi-body shaming. Body shaming, it can lead to a whole lot of problems. Njengoba sibonile omnye umntu apha ude athi atshintshe indawo ohlala, abanye bazibulala ngenxa yoba omnye hambe sithi uyahayika, impempe yakhe incinci and so on. So the issue of size siyiteklishile, and siyabulela kakhulu ugqirha wethu uDr Kgomotso Mathabe, yi-head of department yakwa-urology phaya eSteve Biko Academic Hospital, and then napha e-University of Pretoria. So uphethe amaziko amakhulu amabini e-urology. Zingcaphephe ke ezo, not only zempempe but zale mibhobho yokuchama. Ngabantu abadilishana nabantu abangoomama, badilishana nabantu abangootata at highly specialized level and serious academic staff. That is why sivuya singu-apile to have such a serious guest who has unpacked most of the issues ezixakekisa abantu ukusuka nokuhlala. Ndinethemba loba ii-tape measures namhlanje zizawuphelelwa ngumsebenzi, but sawuxelwa ngabantwana bethu, sikhuthaza abazali, sijonga amatyhalarhu bakhona. Are the testes both there? Impempe ikhona, umntana uyachama kakuhle, umchama utrepheki na, and so on. Dr. Mathabe, your closing remarks, please.
Just to say thank you for the opportunity and to encourage people to continue to ask questions and to continue to ask your doctors. Ask your doctors, search out information, and have somebody who can contextualize your findings. So thank you very much, Dr. Tebelele, for the amazing work that you do in terms of community education. We see you and we appreciate how you are helping us to do our work better.
Thank you so much, Dr. Mathabe, and thank you very much for your valuable time. I'm looking forward to the day when I'm doing a tour with you all over South Africa, with in these community halls and so on, where you will be talking to people live. I like the way you approach questions and the way you answer some of these things is beyond understanding, and it actually a lot of people are happy. When you find time, I don't know if you're in social networks, you should read through the comments. You'll see the impact of your talk, and you'll definitely see that you've done an amazing work in this hour. On behalf of Appeal Communications, from all our platforms, TikTok, YouTube, and Facebook Live, we highly, highly value what you do as an academic, not only for the people who are here today, but this is a library. This is a lifelong information in our platforms, and the impact that will do for generations to come, so that people know what embedded penis is, what micropenis is, what PDD is, and then we get troubled with issues of land, and we protect parliament from banning and so on, rather than focusing on measuring penises and so on and insulting each other. Thank you so much, very much. South Africa loves you.
Thank you, Dr. Tebelele. Have a good
afternoon. Thank you, Doc. Manibulele kakhulu nakuni babukeli bethu nabalandeli bethu. Thank you for listening. Thank you for following. And thank you for all the inspirational comments. Sinethemba lentoba, all the lessons learned are not only for you, but each one teach another one. Thank you so much.
Take care. Bye-bye.
Bye.